A very good evening, all. I'm Aditi Lamba, coming to you from a remote location in New York City. Welcome to the Tuesday night edition of Vision of Asia South Asian News segment. This is our ongoing report on the coronavirus pandemic. More than 3.6 million people worldwide have been infected by the novel coronavirus, with more than 250,000 deaths. In the United States, a new model of mortality predicts nearly 135,000 deaths, with current number of total cases topping 1.2 million and deaths more than 69,000. We cannot stress the importance of following guidelines of social distancing and safe hygiene for all. Please do ensure that you do your part in combating the coronavirus pandemic. Also, if you are on the front line and would like to share your experience with the South Asian community, do write to us on events@itvgold.com. We continue to present top officials and healthcare professionals on COVID-19 updates and information. Today, here in New York, Governor Andrew Cuomo again called for more federal funding for states during the coronavirus pandemic, while also saying that the decision to reopen will be about the balance between economic costs, between staying closed, and the human life cost of reopening. While this is happening, states across the country, such as Georgia, Tennessee, South Carolina, and Florida, are taking reopening measures with the huge economic crisis facing the nation. If your state has reopened, connect with us on Facebook at ITV Gold to share your experience and opinion. Also, the CDC is warning that coronavirus outbreak could be even more difficult next winter, and the House votes today on a new coronavirus relief package soon to help the community. Lots tonight on reopening and its status, along with alarming but educational facts from frontline doctors, children's culture and enrichment, and much more. Here are the headlines. State Representative Angelika Kausche on coronavirus pandemic and reopening in Georgia. Dr. Dixi Patel on coronavirus updates, frontline experience, New York City. The culture trio on literacy and cultural educational during COVID-19, featuring Sehgal. It's time for a short break on Vision of Asia, Voice of the Community. Come back to us right after. Welcome back. I'm Aditi Lamba. This is Vision of Asia, special report on coronavirus impact, measures, and updates. More than 1.2 million cases in the United States, with more than 69,000 deaths. New York, where we're coming from, remains the epicenter and the hotspot with most number of cases and deaths. The World Health Organization today said that the coronavirus continues to remain a global health emergency, and also said that for its importance for countries that are easing lockdown to constantly be on the lookout for a jump in infections and be ready to still have measures be placed if needed. New York Governor Andrew Cuomo said that New York is monitoring new infections, capacity of health system, and the capacity to carry out diagnostic tests, as well as the ability to trace the spread. Bringing in a perspective now on reopening, treatments, and some empowering frontline experience, we spoke with Dr. Dixi Patel in New York City. Dr. Dixi Patel urged all to maintain social distancing and also understand the efforts of healthcare workers across the country in being the real heroes. In New York, concrete jungle where dreams are made of, there's nothing you can't do. Now you're in New York. These streets will make you feel brand new. Their lights will inspire you. Let's hear it for New York, New York, New York. One hand in the air for the big city. Street lights, big dreams, all looking pretty. Give us some guidelines, some tips for our audience to practice within the next couple of weeks, either for their wellness or just, to make sure they're staying safe and healthy.
Yeah, so definitely, I can't emphasize enough, stay at home, maintain the social distancing. I know it's getting really hard. We've been at this for 2 months now. Everybody's probably going crazy being at home and being contained. I know us as humans, we have really short attention spans and can't do that very well. But I think, I think this is a moment for everyone to kind of step back and really just take the time to do the things that you never had the time to do. Like everyone's had this chance to now slow down and look in, and kind of see, hey, this was a passion of mine. Let me try to do this, or let me make some time for this, or hey, I'm here with my family now. Let me spend more time with my family, So I think there's a lot of great things that being at home and being in quarantine definitely has brought for people. And I think they should definitely take advantage of this, because it's not always that you get that opportunity. So obviously for me, I like to sing on the side. So that's what I've been doing to, kind of, when I'm not working, when I'm at home and quarantining at home, I've been going to my music. That's been my outlet. So, and that's been keeping me sane, and that's been keeping me happy. So I think it's important to just find the things that make you happy, try to stick to those things. If you want to go out for fresh air, go out for fresh air, but go by yourself. Go somewhere where there's not too many people. I'm still seeing a bunch of people at the parks. I saw a picture yesterday from West Village, and there was massive amount of people there, which was appalling. But like I said, just be smart about it. If you're gonna go out, go somewhere where it's just you, or like at least more than 6 feet, I would say, just because I'm hypochondriac. But just keep your distance, wear a mask when you're outside. And I know obviously this can take a toll on your mental health, and I know there's people that are dealing with mental health challenges as well. There are hotlines and things that you can call. Reach out to your friends, anyone that kind of helps you through this time. You're not alone. If you're going crazy, just reach out to your friends, reach out to someone that you can talk to. We're all in this together. And yeah, I mean, that's pretty much my message. I just hope everyone's staying safe out there, and I know we'll get through this. I think we just need a little bit more time to kind of work it out and hopefully fight this thing a little bit more. But I think we'll eventually go back to somewhat norm, hopefully in a few months.
Yeah, we often don't understand the experience of people that are on the front line, and what they have to manage with and what they have to deal with on a daily basis, because we're so consumed in in our own quarantined life and our own worries. I really appreciate you for your service, as a frontline hero. What's your message out to other people that are on the front line, and other fellow doctors? What would you say to them?
Yeah, so I mean, it's been a hard time for all of us. I think we've all kind of been in the same boat. I think we've had the same thoughts. I think the main thing is that we've all kind of become united in a way too. There's so many different specialties that have come in, that this isn't their normal thing. I mean, I'm pediatrics as well, so we're not used to treating adults. So, we kind of had to step up. Dermatologists had to step up. Ophthalmologists had to step up, and now we're all treating patients that we're not used to seeing, and we didn't fully train in those specific things. So I think in a way it's almost, it's just really nice to see that it kind of brought us together a little bit. It brought a lot of us together, and I think as doctors we never expected to be in this position. So I think to all all other frontline workers and medical workers, even those that are not frontline, I think this is a great thing, in a way, in a sense, that it's brought us together, and I think it's kind of brought out this hero in us that we didn't really even know that we had. It brought out things in us that we didn't know we were capable of, and I think we're gonna look back one day and be like, wow, like this experience right here, I think this made us stronger doctors, better doctors, more equipped doctors, that when something like this ever hits again, or if anything like this ever hits again, we'll have been through it, and we'll kind of be able to attack it. And I think that's how I'm kind of looking at it, like just to be positive in a sense.
Yeah.
That like, yeah, we were hit with something hard, and it was scary and hard, but like now we're just going to be that much more stronger for anything that kind of comes our way in the future. Starting to reopen the businesses and things like that in certain states is probably not a good idea. I know some states have already started reopening, but I think because of that, we are going to start seeing a new surge of cases, and as you can see, we already are. So I know Dr. Fauci already kind of said, that we need to take our time with reopening the country, and we can't really jump the gun. And I think some states have already kind of started to jump the gun, and because of that, we are now seeing a new surge of cases. And so now they're estimating that these deaths are going to increase by, somewhere I was reading in the New York Times, I think, and it was based off of the CDC. They were saying that the new data was showing that about 200,000 new cases daily will come across the country by the end of May. So, and I think that's just a reflection of us kind of reopening again and kind of jumping the gun a little bit. So.
And the numbers just jumped within a day. Do you think it is because the there are 40 states that are reopening by the end of this week. Is it projected, sort of comprising of these states that are reopening and what they're projecting as the increase of number of cases and then the deaths?
I would think so. I mean, I think just looking at individual states. I mean, I was reading up a little bit on it, and I mean, Texas is seeing a surge. You know, Dallas. I think Dallas. One of the articles I was reading was Dallas reopened, and they had a huge number all of a sudden. You know, and so like they had a huge number of deaths and cases as well. So I think, and I think that was a reflection of reopening. I mean, they just started reopening, and you know, sometimes it takes a little bit of time for the data to come up. So it won't, you know, this data that we're seeing today is probably from a couple of days back. So I do think that it is sort of a reflection of reopening things. You know, we can't put enough emphasis on the whole social distancing thing, and I just think if that's not really being taken seriously, which in some places it hasn't been, I think this is the result of that.
Let's now take a look at the Culture Tree with its mission to promote South Asian culture through educational and enrichment programs. They're focused on cultural literacy as well as providing knowledge on culture, arts, language, food, and events of the South Asian heritage. Since the lockdown restrictions have been put in place, the Culture Tree has implemented its Hindi, Urdu, and Punjabi language classes for kids of all age groups to a virtual platform, along with hosting a variety of programs, discussions, and celebrations online. We spoke with founder and president of the Culture Tree, presenting opportunities to educate children through the pandemic, Sehgal. Here is the story on fun and interactive learning. Sehgal from Culture Tree, thank you so much for being with us on ITV Gold. How are you doing today?
I'm doing well. How are you doing, Aditi?
Not so bad myself. I'm so glad to finally have you here on ITV Gold to discuss all of the awesome things Culture Tree is doing, educating children of our community. We're just starting this interview. A quick insight into what Culture Tree is and what are its programs that are happening right now during COVID.
So the Culture Tree is a cultural literacy organization, and we focus on South Asia. Specifically, we have two pillars. One is dealing with language literacy. So we focus on languages like Hindi, Urdu, Punjabi. Hopefully Gujarati will be added soon. And then the second pillar to our organization is really doing cultural programming with museums, libraries, with schools. So we do both these things. And during COVID, there has been two different things that have happened. Our in-person cultural programming has been canceled completely, but our language programs actually have grown because now it's not just limited to the tri-state area. We can basically have kids from all over the US register for our programs.
Right.
And we've moved to virtual learning. So we've made our program, we have adapted our lesson plans, our curriculum to meet that need, because teaching virtually to kids, and especially we focus on the age group, which is elementary kids, elementary school kids, and then also preschool. It becomes a little different because you have to make it more interactive. You have to make it more fun virtually, and then also bring in more visual clues. And our programming with the museums and the libraries have moved to virtual format. So we are doing Facebook Live events. One big thing that happened was I've always wanted to partner and work with authors and musicians all over the world, and now that is happening. We had a Vaisakhi program. It was a Facebook Live event that the consulate hosted for us, and we had there were two authors from the New York area, and then there was one author from Hong Kong who basically did the live event with us. So that is what has started happening with the virtual programs.
So, lots of virtual programs you're doing Facebook Live. I know you're also working with the consulate, the Indian consulate here, that we also work with to promote these, cultural literacy programs. Can you describe to me exactly what are you teaching at the current moment? Because a lot of parents will be watching you on ITV Gold right now, and they are trying to sort of assimilate to this new style of online learning, virtual learning, and language programs are very important, especially for our community. So they can get an insight into how it's being run right now, And, also what are the resources available for them to educate their children, especially during this pandemic? I think that'll be great.
Yeah. So we have a pretty specific way of developing our curriculum and also lesson plans. And I've worked with programs, bilingual programs at both NYU and Columbia to really come up with my curriculum. And my teachers are trained very thoroughly in this program. And so our programs are very theme based. So we'll come up with a theme, say the theme is body parts. And we'll basically have sentences that are related to that, and then vocabulary building exercise. And then there is a lot of exchange that happens. So each child has to kind of reiterate and say the sentences, and then they have to talk to the kids that are in the virtual call. So it's actually really fun that way.
I know you have a message here for parents, specifically of ITV Gold, and I would love for you to just share that message out, and also your message out to children, that are still trying to learn how to live in this coronavirus pandemic world, and learn and be educated during that time period. I would love for you to address both of them.
I'll start with a message for children. I really do think this is the time. You guys have some time to really think through and connect with your heritage and your parents' heritage. So this is the time to invest time in that. And Aditi, you talked about resources. We have a lot of resources on our website. So definitely connect with us. It's theculturetree.com. And really take advantage of talking to your grandparents and connecting with them, because in some situations you're not seeing your grandparents if they are somewhere else in the US, or they're in South Asia somewhere. So connect with them and really hear their stories, because we need that social connection. So connect with them on that. And then for the parents, I would say it is very critical to provide our children tools for managing multicultural exchanges from a very young age. And these exchanges don't really happen immediately, but have to be imbibed in your child from a very young age.
It's time for the show break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome again. This is Vision of Asia. I'm Aditi Lamba. This is our special report on the coronavirus pandemic. Much today has been discussing several states reopening across the country, including the states of Florida, Georgia, Tennessee, and many more. What is the impact of reopening while the number of cases still continues to see a rise? Or will the economy be relieved with easing of the lockdown restrictions? Bringing in a perspective now from Georgia, earlier today we spoke with Representative Angelika Kausche, who is the state representative for Georgia House District 50th. The district comprises of the highest number of South Asian Americans living in the state of Georgia. Representative Kausche reflected on this reopening of the state of Georgia by Governor Brian Kemp, who has lifted statewide shelter in place and has also allowed many businesses to open. Some are stating that the risk of exposure to COVID-19 has now increased since reopening, and Representative Kausche provided her take. Here is Georgia State Representative Angelika Kausche on economy, healthcare, and the South Asian community, and much more. One of the biggest questions that's concerning, many parts of the nation, reopening of Georgia, to the fact that there are salons, there are movie theaters getting opened, there are malls getting opened. I wanted to get your comment on Georgia's reopening and the impact you've seen on the number of cases of COVID-19.
Yes, Georgia's reopening, which is still a slow reopening, but it still sends to me a very concerning message, because we are not there yet. Our governor was very one of the few states that was very hesitant in going into a shelter in place, and then we were some of the first states that actually started to lift the restrictions again. And what we are seeing now is that many people understand it as like, okay, we're going back to normal, we can go outside again. But on the other hand, the messages we're getting, especially from the experts, the CDC, is that we're really not where we should be to really going back to normal. normal. We still have rising cases, and just today the governor was in Albany, and where we see Albany is one of the hardest hit areas in terms of cases, and then the other area, which is it's a new area that's coming out is actually east Georgia here, not far from us in Gainesville, where we see a severely increase in the cases of COVID-19, especially among minority populations like African Americans and Latinos.
Right. My question to you with that regards would be, if there is a surge in cases, which we keep on hearing on a national scale, that there's going to be a surge in cases, the number of deaths have doubled within the last 24 hours. Is Georgia as a state ready for, increase of number of cases and deaths? Right now, I feel like Georgia is doing fairly okay. But what's your comment on that?
Well, what we did in Georgia, we increased the hospital bed capacity, the ICU capacity, the ventilators, and things like this. So we increased capacity. But in terms of what we're seeing on the ground, I'm personally very concerned. And I think the recent comments from the CDC that say itself, Georgia is kind of like moving too fast, too soon. So my fear is that if we continue on that path, that we actually risk a second surge. Right now we are at flattening the curve. We really have not even met the White House recommendations of a 2 weeks decline in cases. We haven't seen this. We barely have flattened the curve. So going out so early with the message, so we have to reopen. Yes, we understand there is economic pressure and we need to address this. But my fear is with a second surge that we actually could counter the good progress we have made so far.
Have you had a conversation with the governor? Governor Brian Kemp also, had a communication with the White House. President Trump has kind of disagreed with Georgia's reopening status. What is your take on all of that?
Well, I didn't have any direct conversations with the governor, but we're meeting regularly with the governor's teams and getting updates on the progress. And they are working hard to provide, for example, personal protective equipment and increasing the capacity. But as long as we don't have adequate testing and adequate tracing, right, especially from my personal experience with COVID-19, I would be very, very cautious. And I have to say, I'm glad to see, for example, in my area, in my district, people overall heed the message and say we stay cautious, but it goes a little bit along party line, and it goes a little bit along like urban versus rural areas. So the areas that may not have seen so many cases personally feel safer. So for them, the message is, oh, we're opening, so let's just go back to normal. But the problem is that they have, especially in rural Georgia, we see less hospital capacity. It's much harder for people. I mean, Georgia already is a state where we had healthcare deficiencies before this crisis started, and they are now being, with this crisis, are being amplified. So if you live in an area where you don't have direct access to a hospital, or seeing a doctor is way more difficult in these areas, I fear that people will stretch out this crisis even longer without really knowing it, because they don't see as many individual cases as we do here.
As a politician, and also looking at it from a medical point of view, especially with the fact that you had COVID-19 and you are fully recovered, with your journey, what are some of the greatest challenges right now? You are in a state that is reopening. Testing is questionable right now. Treatments are questionable. We're not sure about vaccines. I would love for you to sort of, reflect on that as well.
Well, from my personal experience, we had a very interesting experience, because my husband got infected around mid-March, and he was really, really very, very ill for 3 weeks. Fortunately, he's a very healthy person. He didn't need to be hospitalized. And I got sick about a week later, and I only had it for a few days. So in our own household, I could see there are different categories of how the disease plays out individually. So we simply put, we asked our doctor, we at this point just really don't know enough about this disease. We need to do way more research to understand who gets infected, why. Of course, we categorize the broad categories like the elderly, the medical fragile and vulnerable. That is true, but we also see about 25% of fairly healthy people getting severely ill and at the risk of death from this virus. So I think we need to give time to get way more research and understand how this disease affects individually, based on maybe race, based on genetics. It could be anything, but at this point, we just don't know enough.
And this wraps up our and this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com, or you can also follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight. This is Vision of Asia. I am Liti Lamba. Take care and be well.